Let me read something, and I'd like to ask unanimous consent to place into the record, Mr. Chairman, the American Hospital Association letter in opposing this bill.
Without objection.
Let me just read some of it in my last few minutes. On behalf of the 5,000-member hospitals, health system, and health coverage organizations, including 270,000 affiliated physicians, 2 million nurses and other caregivers, the 43,000 healthcare leaders who belong to our professional groups, the American Hospital Association, expressing our views on the American Health Care Act, legislation to repeal and replace the Affordable Care Act. We believe that legislation needs to be reviewed and carefully evaluated regarding the impact of both individuals and the ability of hospitals and health systems, which are the backbone of our nation's health care safety net, in terms of our ability to care for all those people. Any ability to evaluate the American Health Care Act, however, is severely hampered by the lack of coverage estimates by the Congressional Budget Office. In addition to the lack of the CBO score, we have some additional policy concerns. For example, it appears that the effort to restructure Medicaid program will have the effect of making significant reductions in the program that provides services to our most vulnerable populations and pays providers significantly less than the cost providing now. Let me just close by saying health care is vitally important to working American families, and they rely on hospital systems. We recognize the measure represents a first step, but it's critical this process is thoughtful and focused. We as Congress protect our patients and find ways to maintain coverage for all Americans possible. With this bill does not. We look forward to continuing to work. We cannot support the American Health Care Act in its current form. That's why we need some amendments, and I yield back my time.